Thank you for joining me, Dr. Peters. It's great to chat again. Could you maybe introduce yourself, discuss your background in IBS and gut-directed hypnotherapy and how you came across Nerva?
Sure.
Built Nerva?
Sure. Thanks for having me. So my name's Dr. Simone Peters, obviously, and I've been working in this space of gastrointestinal disorders for the last sort of 10 or so years. So I work as a clinician, so I have my own clinic in Melbourne, Australia, and I provide gut-directed hypnotherapy within this clinic, but we're a multidisciplinary team, so we look after patients with all sorts of gut problems using lots of different treatment modalities. I also wear a research hat, so I work with Monash University in a research capacity, again, looking at ways that we can identify treatments for patients who present with gut-related disorders. And I also work with Nerva as the head of the clinical content for the program and act as a scientific advisor for Mindset Health.
Thanks for that. For those who didn't know as well, I attended Monash University, so my link there as well. Maybe first of all, we'll jump into an overview around IBS and answer some questions that people have around that. So what is IBS? How many people have it? What causes it?
Okay, so we call IBS, which obviously stands for irritable bowel syndrome, a disorder of brain-gut interaction. Now, we have fancy criteria that are called the Rome 4 criteria, which we use to diagnose somebody as having irritable bowel syndrome. And this means that they need to have abdominal pain at least 1 day per week for 3 months. And that pain needs to be associated with their bowel movements. So often this is with regard to change in the frequency of their bowel movements or the form, and that might be related to them having diarrhea or constipation. Now, they're the symptoms that people need to meet the diagnostic criteria for having irritable bowel syndrome, but lots of people with irritable bowel syndrome also present with other symptoms. So symptoms like abdominal bloating or distension, wind, and sometimes even upper GI complaints, so things like nausea or reflux as well.
And is there anything known that causes it? Is there anything why some people get IBS and others don't?
We don't really know what causes irritable bowel syndrome. We know that there's probably lots of different factors at play. So some of those might include things like intestinal motility. So your motility is the time it takes from when you eat something to when you pass that same thing at the other end. And we know that often people who have irritable bowel syndrome have issues with what we call their motility. It's also really common for patients to have issues with what we call visceral hypersensitivity, which is just a very fancy way of us saying that the nerves that are in their tummies are probably much more sensitive than what we want them to be. And we think that this can also contribute to symptoms of IBS. Of course, interactions between the brain and the gut can play a role, and also the microbiota. As an example of that, it's not uncommon for us to see that patients present with symptoms of irritable bowel syndrome after they've developed gastroenteritis, whether that be bacterial or viral, and for whatever reason, that alteration in the microbiome has resulted to them having these really terrible tummy symptoms.
Is there any relation to mental health, or how is mental health related to IBS?
So there are a subset of patients who have irritable bowel syndrome who have comorbid psychological issues. So that means that they present with anxiety and or depression. However, the question is always whether it's the chicken or whether it's the egg. And so, of course, there are, like I said, a subset of patients who do have anxiety or depression, and it's probably unlikely that that contributes to the symptoms. But there's also another percentage of patients who might have anxiety or depression as a result of feeling pretty miserable in terms of their gut-related complaints. So probably somewhere between 40 and 60% of patients with irritable bowel syndrome will have comorbid anxiety and or depression.
Is there any other conditions that are comorbid with IBS?
There's many. We know that often patients who present with irritable bowel syndrome have chronic pain disorders, which is really very common. So something like fibromyalgia is an example. Often people have sleep complaints, so they have sort of sleep disorders or other things. Mental health is obviously a really big concern. Not necessarily linked, but often we see patients who have irritable bowel syndrome who present with issues around endometriosis is really common. And so it's always about sort of untangling what symptoms are triggered by the endometriosis and what symptoms are triggered by the irritable bowel syndrome. But the list does go on, I'm afraid.
And if you're someone who hasn't been diagnosed with IBS but is experiencing these sort of gut symptoms, what's the process to getting diagnosed? What should they do now?
So I think the best thing to do is obviously to present to your healthcare professional, so your GP, and obviously to have a conversation with your GP around the symptoms that you have. And your GP will pretty quickly identify whether you need to be escalated to see a gastroenterologist or not. There are some tests that can be done at the GP level and certainly should be done at the GP level. And that your GP would work with you to sort of identify what those tests were. And if there's any red herrings or there's any sort of concerns, then the patient should always be referred to a gastroenterologist who would do a more complex overview of why it might be that the patient might be presenting with those symptoms.
Awesome. And so imagine you're this person, they've just been diagnosed, they have irritable bowel syndrome. What are the next steps? How do they manage their symptoms? What are the most common ways that people manage their symptoms?
So I think the really important thing, first of all, is to get a really firm diagnosis of irritable bowel syndrome. And I know that probably sounds a little bit obvious, but often people go through having many different investigations done and they're sort of given this throwaway line that we couldn't find anything, so there's no problem. And they certainly may well have not found anything, you know, from a histological perspective, so there might be no inflammation or no ulceration, but there's certainly something going on. These patients still have these really terrible ongoing symptoms. And like I mentioned to you before, there's really defined criteria for somebody having irritable bowel syndrome. So I think that's the first consideration, to get that really firm diagnosis of having IBS. And then after that, because there's no cure, unfortunately, for irritable bowel syndrome, it comes to managing symptoms. And I suppose when we look at different ways of managing symptoms in people who have irritable bowel syndrome, there's three kind of domains that we can largely explore. So one is going down the medication route. One is going down the dietary-based therapy route, and one is going down the psychological-based therapy route. Now, often people go down the medication route first, and that's fine. Unfortunately, however, we don't have one drug that fixes all symptoms. And like I said to you before, most people who have irritable bowel syndrome present with lots of different symptoms. And so it becomes really challenging. We can give you a drug to treat a symptom, but if you present with lots of symptoms, you end up on lots of drugs. Of course, all have their own side effect profiles, and so on and so forth. So if we do use medications, it's usually to target the most troublesome symptoms for those patients. Then we look at diet, and I suppose if we look at diet, the diet with the most evidence to support its use is a diet called the low FODMAP diet. This is a really excellent diet. It has really great rates of efficacy, and we use this as a first-line therapy in our patients who have irritable bowel syndrome. And then if you go down the psychological path, the psychological therapy that has the most evidence to support its use in terms of managing the physical symptoms of irritable bowel syndrome is gut-directed hypnotherapy. And similarly, we use gut-directed hypnotherapy as a first-line therapy in our IBS patients.
That's a great segue to the next section I would be interested in talking about, which is gut-directed hypnotherapy. Could you describe what is gut-directed hypnotherapy?
Okay, so the way I usually describe it is that it's kind of like deep relaxation. So daydreaming is an example of hypnosis, although I'm sure all of the viewers today have seen people doing, you know, weird and wonderful things on the TV and the movies, clucking like chickens or whatever it might be. Now, obviously those people are also in a state of hypnosis. So clearly you can see that there's varying levels of depth of hypnosis. Now, when we apply hypnosis in a clinical setting, we just need the person to feel relaxed. So we certainly don't need them to get to that level of depth whereby they have no conscious recollection of what's going on around them. In fact, only about 15% of the population will get to that level of depth. So it's pretty uncommon for people to get all the way to a state where they have no conscious recollection of what's going on. And importantly, we know that depth doesn't correlate with outcome. So we get worried about the fact that people might not get into that really, really deep state. As long as they feel relaxed, then we're happy. But essentially, gut-directed hypnotherapy is getting the person into that state of hypnosis, into that state of deep relaxation, and then making suggestions to what we call the subconscious part of the mind. So we have two different parts of our mind. We have the conscious part, which is the part that we're communicating with now, and then we have what we call the subconscious part of the mind. And it's the subconscious part of the mind that we target through hypnosis. And when we're relaxed, that part of the mind is more receptive to suggestions. And of course, it's the suggestion part that makes it hypnosis. So that suggestion to the subconscious part of the mind.
And how does that help, I guess, with stuff like IBS or other conditions?
So essentially what we want to do is we want to make those suggestions specific to the symptoms that the patient presents with. So that's what makes it gut-directed hypnotherapy as opposed to just standard hypnosis, I suppose. So it's the direct suggestion to that subconscious part of the mind for the control and normalization of gut function.
Could you dive a little bit deeper to what gut-directed hypnotherapy session would feel like in your practice?
Sure. So typically patients will come along for a number of sessions. So unfortunately, nobody is cured after one session. If I do have a patient that's ever cured after one session, I suspect that person will be the only patient I see in my time that has such a great response. So people typically come for a number of sessions, and we generally see the greatest rate of improvement between sort of 4 to 6 weeks. So I suppose people come into the session, and then there's usually a psychoeducation component. So I want to teach people all about what irritable bowel syndrome is, why they're in the position that they're in, all of the different treatment options that are available to them, why we're going to use gut-directed hypnotherapy, and then talk in lots of detail about the gut-brain axis and lots of other things. And then, of course, the hypnotherapy component. So typically I'd see patients for 45 minutes to an hour each time, and probably half an hour of that would be around psychoeducation, and probably 15-20 minutes of that would be the gut-directed hypnotherapy component. And of course, the hypnotherapy component is getting the person to sit in a really comfortable recline, which I think you can actually see behind me, and then getting them to close their eyes. And then we do sort of, the best way of describing it as being a bit like a guided visualization or a meditation, if you like, where I essentially present a story to the patient. And obviously the story relates to their tummy. So we use lots of different creative metaphors to get them to be able to visualize their gut in a particular way. And then we provide that suggestion. So it's the suggestion component that obviously makes it hypnosis, opposed to meditation or storytelling or whatever you want to call it. So we'd present those suggestions, and then once those suggestions were presented, the patient would be sort of counted out of that hypnotic state and then sent on their way.
Hopefully feeling better after 4 weeks.
Correct.
You mentioned something there around the gut-brain axis. Could you touch on that and explain maybe what it is, how it relates to irritable bowel syndrome, and how it relates to gut-directed hypnotherapy?
Yeah. So the gut-brain axis just refers to this connection, I suppose, that we have between our brain and our gut. And this is largely through what we call the vagus nerve. So we know that the brain and the gut are in constant communication with one another, which means that things that are going on at either end can contribute to symptoms. So if we think about things that are going on at the gut level, then like I mentioned to you before, that's issues around motility and sensitivity, dietary influences, effects on the microbiome. So all of those things that are going on at the gut level can play a role. But then there's also things obviously that go on at the mind level. And this is when we talk about things like stress and anxiety, worry, lowered mood, depression, and so on. And so I guess most patients can recognise that things at both ends contribute to their symptoms. as an example, if they are traveling, now that we're all allowed to travel again, if they're traveling on an aeroplane and they have terrible diarrhea, that might be quite a stressful event for that particular person. And they might find that actually when they do that, the stress levels rise. When they do that activity, so they go on the plane, their stress levels rise, and that contributes to worsening diarrhea, as an example. So that could be something that's going on at the mind level. But then there's often people can recognize there's things going on at the gut level. So if they went out and they ate X, Y, or Z, they might be, in a terrible position afterwards. And so the aim of the hypnotherapy, really basically, I suppose, is to get the mind and the gut working together better, if that makes sense. But I think a really fascinating fact, which I often tell my patients, is that the two systems are so linked that 95% of serotonin, which is the hormone that primarily regulates our mood, 95% of that is produced by our gut, not by our brain. So we kind of can't underestimate, I suppose, this link between the brain and the gut and the impact that that has on our overall symptoms.
An example I like to use, and when I think about it, is butterflies in your stomach when you're anxious, and then you're in that fight or flight response, and then the blood's flowing away, and then you're getting nausea and stuff. And that's just like one example that's like common to many people. And if you think about that power of like how you can modulate and change how you feel in the gut based on your brain, it's like it's a really clear link. And when you talk about exactly that, addressing the miscommunication between the gut and the brain.
That's exactly right. And it's not necessarily indicative of there being a problem. If you use that as an example, butterflies in your tummy, or doing something that's really stressful, some people will get butterflies in their tummy. Some people will get, I get terrible headaches. If I'm really stressed or worried about something, I will get an excruciating headache. But the vast majority of my patients, when they get stressed or worried about something, they end up with all of these really notable tummy problems.
So it's sort of, overreactive to this response potentially.
Yeah, well, you sort of just, like you said before, you go into this heightened sympathetic state that, sets off this cascade of events. And I guess especially in people who have irritable bowel syndrome, that results in changes to the blood flow in the gut. It increases the sensitivity of the nerves that line the gut. It has an impact on motility. So these are really notable and tangible symptoms, right? But they're largely dictated or caused by that patient being in that heightened sympathetic state. And of course, if they're in that heightened sympathetic state for something that's really notable, and I will often give the example to my patients, of somebody, getting married or getting divorced or having a baby or selling a house or buying a house, like they're really stressful things that we will all experience. And, you would expect to be in a heightened sympathetic state during those times. And it's logical and reasonable that you might get tummy symptoms in response to that. But we don't want people to be going into that heightened sympathetic state on a day-by-day basis. Not when, you're running late for a meeting, or you get a parking ticket, or, you're, I don't know, running late to pick the kids up from school, or whatever example you can come up with. So it becomes about trying to get people into a lower or more of a parasympathetic level of control, as opposed to a heightened sympathetic state for day-to-day stresses.
Right. So it's, coping and managing that process so you stay in a parasympathetic state.
As much as possible.
Nice. Going back to gut-directed hypnotherapy. So we're talking about, the process of, doing gut-directed hypnotherapy. And you mentioned earlier that it is a, first-line option for many people with IBS. What is the science behind gut-directed hypnotherapy? Is it, well-researched, and is there a lot of science supporting it?
Yeah, so there's a really good question. There's been heaps of trials that have been done in this space now, especially over the last 10 years. We've seen a real interest, I suppose, in using gut-directed hypnotherapy as a management strategy for irritable bowel syndrome. And we know that the vast majority of patients respond to this as a treatment. So we know that somewhere between 70 and 80% of people, depending on which study you read, will respond to gut-directed hypnotherapy. And of those people who respond, we see about a 70-75% reduction in their symptoms. I think most importantly, those improvements are maintained in the long term. So what that means is that this isn't an expensive and time-consuming placebo, but if you do respond to the treatment, then we would expect you to stay well in the long term. If it were a really time-consuming and expensive placebo, we wouldn't expect you to maintain those effects, which is why it's really important that when we do research trials, we look at long-term outcomes. But like I said, the vast majority of people respond. The vast majority of people respond really beautifully. They see really nice improvements in their symptoms, and we see that those improvements are maintained in the long term. And that's done in face-to-face settings, but also via telehealth or app-delivered programs like Nerva, as an example.
Could you talk, so we're talking about the studies, you've conducted your own study, your own randomized controlled trial into this space. Could you talk us through that groundbreaking study?
Yeah, so I was doing my PhD with Monash University at the time, actually in a completely unrelated topic. And somewhere along the line, my PhD became hijacked by hypnotherapy. So if I wouldn't have expected that I would, spend the next 10 years of my life delivering gut-directed hypnotherapy, but we've become kind of obsessed with it since we did this trial. So essentially this was a trial where we directly compared the efficacy of gut-directed hypnotherapy to that of the low FODMAP diet. Then we had a combined arm too, where people received both the hypnotherapy and the low FODMAP diet. And obviously they received the hypnotherapy in the same way that we deliver it now clinically. So they were taught the hypnotherapy techniques over a 6-week time period. And those patients who received the low FODMAP diet were taught the principles of a low FODMAP diet in week 1, and then they were taught the reintroduction process in week 6, which similarly is what you were doing in clinical practice. And then obviously the people who were in the combined treatment did both. They did both the hypnotherapy and the dietary intervention. And we measured lots and lots of different outcomes. And we measured those things from the beginning of the study to the end of the active treatment, regardless of what that treatment was. And then we did a long-term 6-month follow-up. What we essentially found was that the people who had received the gut-directed hypnotherapy responded just as well as those people who had received the dietary therapy. Oh. So in other words, people saw the same degree of symptomatic response, but without changing a single thing that they ate. And again, keeping in mind that these improvements were maintained in the long term, which is really key. And so we were quite surprised by that, to be honest. So I was doing my PhD with the group who developed the low FODMAP diet. So of course we're all very FODMAP obsessed. And we were very surprised, I suppose, that hypnotherapy was equally as efficacious as a low FODMAP diet. And certainly we know that there's a percentage of people who don't respond to a low FODMAP diet, probably about 25%. And so what this meant for us was that we had a really great strategy for patients who either don't want to manipulate their diets or they try to manipulate their diet with a low FODMAP diet and it doesn't work, or people who want to do a little bit of a combination of the two. They might see some improvements with a low FODMAP diet, but they also see some improvements with the gut-directed hypnotherapy, and that sort of enhances their response.
What was the, I guess, the hypothesis around why they were so similar in efficacy?
So we actually suspect that they're targeting the same mechanisms. So when we put people onto a low FODMAP diet, what we're essentially trying to do is reduce the amount of fermentation that occurs in the gut. And by doing that, by reducing the amount of fermentation that occurs in the gut, we alter two things. We alter the patient's motility, largely not only because of the fermentation capacity, but also because FODMAPs are what we call osmotic agents. So they work by drawing water into the bowel. So often that can have an impact on somebody's motility, obviously. So that mechanism is being targeted, I suppose, on a low FODMAP diet, so that idea around motility. But if we reduce the amount of fermentation that's taking place, we also reduce the pressure on the nerves that line the gut, so this idea of hypersensitivity. And we suspect that actually when we do the hypnotherapy, we're targeting exactly the same mechanisms. So there's been a couple of nice studies that have been done that have looked at gut-directed hypnotherapy and have targeted these mechanisms. So we have done these studies where we get people to swallow these little cameras, and we track at what pace those little cameras move through somebody's digestive tract. And what we've been able to show after a course of hypnotherapy is that we can alter somebody's motility. So we can change the rate at which those little cameras move through somebody's gastrointestinal tract. And there's been some other studies that have been done, these poor participants who are very grateful for doing our research trials. But essentially what happens is that balloons are blown up inside people's bottoms, and we get them to recognise at what point they describe pain. So in people who have irritable bowel syndrome, we can only blow those balloons up to a very small degree before that patient will tell us enough, we're in pain, as opposed to people who don't have irritable bowel syndrome, where you can blow that balloon up to a much larger degree before the patient would say exactly the same thing. And what we've been able to show is that we can normalise that response after hypnotherapy. Wow. So again, we're targeting these same mechanisms as a low FODMAP diet, but just in a completely different way. And I suspect your next question will be, well, how is hypnotherapy impacting motility or sensitivity? We can show that it's doing that. And I guess the answer to that question is we have absolutely no idea.
That's the next step in the...
Yeah. That's right.
So it's sort of like, you know, the FODMAP diet, the low FODMAP diet is like a bottom-up approach, you know, doing it from the gut up, where like, you know, gut-directed hypnotherapy is doing it from like the top down.
Yeah, you're exactly right. But also keeping in mind that when we do these research trials, we don't include patients who have notable psychological complaints. So they don't have clinical anxiety or clinical depression. And so it's also not a therapy that needs to be saved for those patients. It's a therapy that can be applied to people who don't have any psychological comorbidities at all. And we would expect those patients to respond really beautifully.
That's a really great point to bring up, because we often get a question, you know, is gut-directed hypnotherapy only for people with anxiety triggers? But my triggers have, you know, are based on food and will work for me. So, you know, if one of your patients asked you that, what would you say?
So the question was, my symptoms are triggered by food. Can hypnotherapy work for me?
Exactly.
Well, yeah, it's targeting the same mechanism, right? So when the patient cuts that food out from their diet, essentially what they're doing is they're altering their motility and they're reducing the hypersensitivity of their gut. But presumably when they put that food back in, they get those symptoms. So yes, they can still respond really beautifully to the hypnotherapy. And typically what we see in clinical practice is that if we do, and again, quite often by the time people come and see us in clinic, they're what we kind of call dietary cripples. Their diets have become so restricted over many, many months, many, many years. And so what we often do in those patients is we apply something like the hypnotherapy, and we aim to get really good control of symptoms using quite clearly a different approach. And then we try and liberalize their diets as much as we can. The question of how much we can liberalize their diets by is obviously different for each person. But in theory, based on the trial that we did as an example, you don't need to restrict your diet in order to get really good control of your symptoms. So in theory, yes, you should be able to use hypnotherapy and liberalize your diet. The question is by how much? Awesome. Also keeping in mind that food is going to cause symptoms in people who don't have irritable bowel syndrome. And I use this example, you know, in my patients, you know, like your galacto-oligosaccharides, so, you know, your legumes and your pulses and all of these kind of things, right? If you and 10 mates went out for dinner and you all went to Mexican and you all ate lots of these, you know, legumes, pulses, whatever they might be, and none of you had irritable bowel, I suspect by the end of the meal, there's probably going to be a few of you that aren't feeling 100%, right? Or you think about the old ads, you know, baked beans make you fart. That's not because they only make people fart who have irritable bowel. It's because of the way that they ferment in our gut. So, you know, there are going to be foods that cause symptoms in people regardless of whether they have irritable bowel syndrome or not. And so again, if we use the hypnotherapy to improve their motility and their hypersensitivity and all of these other things, and then we liberalize their diets as much as possible, it might still be that there's some foods that cause some symptoms. The question is, does that now fit within the realm of normal, or is it still outside of the realm of normal?
And how do you think someone should go about that process of liberalizing their diet?
I think really the best way of doing it is linking in with a brilliant gastrointestinal dietitian, somebody who specialises in this space, and a dietitian who's really on board with liberalisation as opposed to restriction. I think that's, the really key thing. The other thing I often tell my patients, if you don't, I guess the other problem is accessing, a dietitian who specialises in GI sort of disorders. And if you don't have access to somebody who specialises in GI disorders, the Monash University Low FODMAP Diet app has a really great a section on the reintroduction process, which is something that could most definitely be explored. Or I guess through trial and error. I always tell patients you have the same enzymes and same transporters in your gut all of the time. And so I sort of tell them to apply a 3-strike policy. If you eat something and you react to it 3 times in a row, probably, reasonable to avoid that food, certainly for the time being. But if sometimes you react and sometimes you don't react, it doesn't really sit comfortably in my scientific mind. And so I usually get people to sort of try and explore that a little bit more if they can. But I think support, and I think often, people who have irritable bowel syndrome need support, and often a multidisciplinary team. So they need a GP and a gastroenterologist and a dietitian and a hypnotherapist and a psychologist or pelvic floor physiotherapist or whoever they need. And I guess the key is to be happy to put your hand up and ask for help.
Amazing. So I guess flip side of the question I just asked, how does hypnotherapy help with anxiety and stress triggers? I think we've already explored it, so maybe we don't have to go too in depth, but I know someone had that question as well around that.
So again, we don't use the hypnotherapy to target the anxiety or the depression, but often what we tend to find is that when we target people's physical symptoms, we see improvements in their psychological symptoms, which makes logical sense, right? If you don't feel well all of the time and then you feel better physically, you're probably going to feel better psychologically. What we typically talk to patients about is that if we get them better physically, so we fix their tummy problems, but they've still got ongoing issues with anxiety, as an example, at that point, we would be linking in the psychologist.
Yeah, that makes sense. So there's a question that, I was going to ask, and there's already a question from a user about that. I'm still if I'm, using Nerva or going to go to a hypnotherapist, how should I feel? So I feel awake and I feel conscious and it doesn't feel like, I am hypnotized. Am I doing it right? Or is it not working for me?
So you just need to feel relaxed. So I always tell my patients, I want you to feel as relaxed as what you would if you were lying on the couch watching telly of an evening. And if you can get to that level of depth, that's all we need for a clinical response. So we've looked at lots of different predictors of response. So in other words, we've tried to identify who is more likely or less likely to respond to this as a therapy. And we looked at depth of hypnotic state as one of those things. So we can measure how deep people go into a state of hypnosis on a scale. And what we've been able to show is that people who are in the lightest possible hypnotic state, i.e. daydreaming or sitting on the couch watching telly kind of depth, they respond equally well as the people who go to the deepest possible state and have no conscious recollection whatsoever. And so the way I answer that question is, as long as you feel relaxed, it's working. Don't overanalyze it. I think the other thing as well is that often, quite often what my patients will tell me is that there's sometimes when they're able to focus really beautifully on the session, and then other times when for whatever reason their mind wanders. So they're thinking about what they're cooking for dinner or what they're doing on the weekend or what school activities they've got the next day or whatever it happens to be. And I guess the part of the mind that is thinking about those things is the conscious part of the mind, which is actually not the part of the mind that we're targeting. We're targeting, remember, that subconscious part of the mind. So I wouldn't worry too much about that. I would just go with it as best as you can. And the only thing I will say is that we don't want people to fall asleep when they're doing the recordings. So often people will listen to the session at night when they're sort of crawled up into bed, and that's fine as long as you don't fall asleep. Now, if you go into just a really deep hypnotic state and you don't consciously remember everything, then you will know that that's the case because you'll see that you wake up 15 minutes after you've started, right? But if you wake up an hour after you started or 3 hours after you started, clearly you've fallen asleep and that's not ideal. So I would encourage those patients to try and listen to the recording a little bit earlier on in the day.
Right. So that's interesting. So that's the sort of, sort of signal if you fell asleep. If you're waking up at the end of the session, it's likely you just, really got into a deep hypnotic state. But if you woke up the next day, yeah, you're probably asleep.
Not the right time. Yeah.
A common question we get asked is, we talk about this, how it feels similar to a guided meditation. So how is gut-directed hypnotherapy or hypnotherapy in general different from meditation?
It's really similar. In fact, I often ask patients if they've tried meditation as a way of getting them to have an understanding of what we'll be doing together. So really similar. So guided visualization is a key component of some types of meditation and also hypnotherapy. The thing that makes it hypnosis as opposed to meditation is that direct suggestion. And the thing that makes it gut-directed hypnotherapy as opposed to normal hypnotherapy is that the suggestions are made for the control and normalization of gut function. So another way of thinking of it is that hypnotherapy is like guided meditation with suggestion, if that makes sense.
I do recall as well, there's been some brain scan studies showing differences as well into how it affects the brain.
Yeah, so there's some really nice studies that have been done which have shown that different parts of the brain light up on different therapies. So guided visualization versus meditation versus hypnotherapy. So we suspect that it targets slightly different parts of the brain and therefore has a different outcome. But that research is in its infancy, but really exciting.
Very exciting. Seeing all there was like a Stanford study talking about the different areas of the brain. It's like, wow, that's super interesting to see that light up.
Really fascinating. Yeah.
So you brought up, the recordings in Nerva. So could you maybe talk about what is the Nerva program and like what happens over 6 weeks?
So the Nerva program is a program that we developed to mirror, I guess, essentially what we do in clinical practice. So one of the big barriers, I suppose, for people accessing hypnotherapy is having access to trained professionals that specialise in gut-directed hypnotherapy. And so we developed Nerva to simulate what you would get in a clinical setting. So essentially, you go through a program, so a 6-week program, where you receive psychoeducation. So lots of, like I said before, lots of information about what irritable bowel syndrome is, what the gut-brain axis is, some different behavioural things that we can do to help better manage your symptoms. And then, of course, the gut-directed hypnotherapy component. And that component goes for about 15 minutes a day, I think, those recordings. So you can, obviously, users can do those recordings at any time throughout the day, whenever they can sort of fit it in. And obviously in an environment that they feel really comfortable in as well.
Obviously, app-based hypnotherapy is more like a management tool, but has there been any studies or anything that looked into how app-based hypnotherapy or audio recordings are compared to in-person?
Yeah, so we have done some of those studies, Alex. We've done we've collected some really nice retrospective data, which means that we just look back over time and see how people have responded. So I do this wearing my Monash University hat, and we look at all of this data, and what we've been able to show is that people who do Nerva, who do the gut-directed hypnotherapy program through Nerva, respond to the same degree or a very similar degree to those patients who receive face-to-face gut-directed hypnotherapy. There's also been, so that's obviously really encouraging. It means that it can be applied at a much larger scale to a much larger audience, but with the same rates of efficacy. So clearly that's a really good thing. And there has been some other work that's been done in other sort of psychological-based therapies, cognitive behavioural therapy as an example, where they've again compared the rates of efficacy of app-delivered versus face-to-face treatment, and similarly they've found no difference in response. So I think, delivering, therapeutics via an app is probably the way of the future.
very exciting for hopefully everyone who's listening and tried Nerva, and all the millions of people that will try Nerva in the future.
Yeah.
So we talked about the first 6 weeks of the Nerva program. So what happens after that? How should people best, manage their symptoms? How should they use the program?
So we know that the vast majority of people respond really beautifully over that 6-week time period. So like I said to you before, 80% of people respond, and they see about a 70-75% reduction in symptoms. Now, when we look at the raw data for those people, when we look at the level of control that they have, they fit within a level that would be considered of a normal, healthy population. So essentially what that means is that they actually don't meet the diagnostic criteria for having irritable bowel anymore, which is obviously fabulous. We've done our job. That's what we're meant to do. And like I said to you, we know that people who respond really favourably maintain those improvements in the long term. Now, I suppose in research settings, we don't dictate to patients what they need to do between the end of that 6 weeks and that 6-month follow-up. So I'm sure there most definitely would be a percentage of people who keep listening to the recordings. There's probably other people who think, oh, thank goodness, that's over. I never want to listen to another one again. Fine. If they still maintain that degree of improvement, that's great. And I suppose clinically, I tell patients the same thing. You've got these tools in your toolkit that we've given you, and you can apply those moving forward as you see fit. So if you want to keep listening to the hypnotherapy recordings, great, go for it. If you feel like you don't need them, as in your symptoms are really beautifully controlled, then you don't need to continue listening to the hypnotherapy recordings in order to maintain that effect. To be fair, most patients like to keep listening to them, which is great. They can most definitely do so. The other thing is that they can just save them for a rainy day. So, if something notable happens in the future, they go through a particularly stressful event, they're traveling, and, lots of people become terribly constipated when they're traveling because you're eating all different food and you're not drinking water. It might be, say, for example, that you pull the recordings out then and you re-engage with the app and you listen to the app just during those periods of time, which I think is obviously also really, really useful. The only other thing I will say is that often, again, there's quite a large subset of patients who are on some sort of dietary restriction. And so it might be that by the time we get them to the end of that 6-week time period, using the app as an example, it might be a really good time for them to start working with a dietitian to liberalize their diet. And if that's the case, I always encourage patients to keep going with the hypnotherapy while they're going through that reintroduction process as a bit of a safety net. And then when they've finished that reintroduction process and their symptoms are still really nicely controlled, they can then decide whether they want to keep listening to the hypnotherapy recordings still as a safety net, or whether they want to sort of back off. And I support them, I suppose, either way.
There's something interesting as well, where, we see that beautiful improvement in their symptoms and their management of symptoms after 6 weeks, especially in like clinical sense. In the research, that was shown at they had to listen 5 days a week, at minimum 5 to 7 days a week. So it'd be interesting to hear your thoughts on, but at the end of 6 weeks, if you've been listening 5 to 6 weeks and you're being managed beautifully, that's a great time. But, what if you've only been listening 2 times a week? How should you approach that? Yeah.
So again, in research settings, where we're really on top of what we call compliance. We have to have everybody as compliant as absolutely possible. And so we defined, like you say, compliance in a research setting as 5 listens out of 7 over a week. And we know that when people listen to, at least 5 times over the course of the week, then they see that percentage of improvement. So we can say that without a doubt, because that's done in a clinical setting, a very controlled environment. But obviously people don't live in clinical trials, right? That's not the real world. And so I always encourage people to listen to the recordings as much as they can. So to try and listen to a recording every day. Now, that said, sometimes life gets in the way, right? Things happen, people are busy, you travel, whatever it happens to be. And you're right. I think if you miss a number of days, or you miss a week, or whatever you miss, that's fine. Don't stress about it. But try and pick it up as quickly as you can. So if you're traveling for a week, fine. You probably don't want to listen to a hypnotherapy recording while you're traveling. Don't. But when you get back, start to try and get back on the bandwagon as quickly as you can. And obviously, the less frequently you listen to something, the longer it's going to take for you to respond. But if you're aware of that, if you know you're only listening to it once or twice a week, but it takes you 2 or 3 times as long to see the response, well, that's fine. If you're happy with that, then that makes logical sense. That's fine.
Makes total sense.
Yeah.
I do know some people as well, like love to listen, they're on the plane and they listen during that time when, they might be more stressed as well. So yeah,
Completely.
each to their own about the travel.
Completely. And again, it depends on obviously the person, but I will often tell people to do exactly that. If flying is a fear of yours because you don't have ready access to a toilet, great, listen to the recording on the plane. Or if, you're about to give a presentation at work and you're really nervous about it, lock yourself in your office for 15 minutes beforehand, chuck your AirPods in and listen to the recording prior to your meeting. That might just be enough to get you in that parasympathetic level of control so that you don't end up with all of these terrible tummy symptoms. So you can time your listens, if you like, to your advantage.
That's really interesting. One final question before we go into the audience question and answers. What inspired you to help create Nerva?
So I think it was just all about patients being able to access the therapy, to be honest with you. So I had developed, obviously, this program as part of my PhD, and then I'd finessed it in clinical practice. But there's only so many hours in the day, and there's only so many patients I can see or somebody within my clinic can see, and we have really long waits, and it's really expensive for people to come and see us. And so I think I was inspired to work with Mindset Health to create Nerva, to make a really worthwhile therapy with a really strong scientific evidence base available to people who wouldn't be able to access it via ordinary face-to-face means.
Yeah, that's what motivated me as well. That 15% of the population, 10 to 15% of the population of IBS, there's nowhere near enough like qualified practitioners, whether it's dietitians or hypnotherapists, that can help these people. And I know a lot of people are super desperate for anything that can help them, and hopefully Nerva can be that option for them.
Completely. And like you say, if you look just at the basic statistics, I mean, obviously we're in Australia, so I can give you the Australian stats, but in Australia there's 3.6 million people with irritable bowel syndrome, and I know a handful of people across Australia that provide gut-directed hypnotherapy. So it's just not anywhere near enough practitioners for the patients who require this kind of therapy. And so something like Nerva means that, like I said before, a really good quality, strong, evidence-based therapy is available to almost anyone.
In your pocket, from your couch.
In your
or
pocket.
your bed.
Correct. That's exactly right.
Well, thank you. So let's maybe jump into some of the question and answers. If you have any more questions, please send them through. We've got 10 minutes, so we'll see if we can get through as many as we can. One of the questions from Robin is, what do you recommend, just prefacing everything, nothing what we talk about today is, medical advice. If you want medical advice, speak to a healthcare practitioner. It's all general and, educational purposes only. But what do you recommend for flare-ups which are triggered by stress and food when I'm not at home?
So it depends on what the symptom is always. And I guess the way I would respond to that question would be based on what the symptom is. So for example, if somebody had terrible bloating, I might encourage them to use an antispasmodic. So to have like a peppermint oil capsule or a cup of peppermint tea or something like that. And then to use their gut-directed hypnotherapy recording if it were available to them. And I suppose, keep in the back of your mind that you feel horrid at this point in time, but the time it takes from when you eat something to when you pass something is 12 to 48 hours. So worst case scenario is that you might feel pretty miserable for 48 hours. And I'm not taking away from the fact that you're going to feel miserable for 48 hours. But after that period of time, you should be pretty good. So it kind of comes about survival for that period. So whatever strategies you've got to make yourself feel better, I would employ. And I would use the hypnotherapy hypnotherapy recordings at that time, and it might just help you get you back into that parasympathetic level of control so that the sensitivity of the nerves in your tummy subsides.
As someone who is following a low FODMAP diet and also using hypnotherapy or Nerva specifically in week 2, how did they get comfortable around food? And I guess maybe it's part of that, reintroduction, but also part of the, I'm not feeling better yet.
Yeah. So I think one of the key things, and I suspect that in week 2, you've not come across this information yet, but we do talk quite a bit about diet in the app and the role of diet as a therapy. So I think the first thing is to try and, if you're not already, link yourself in with a really good GI specific dietitian so that they can have these conversations with you around why we use diet as a therapeutic tool. And then once you've got a really good thorough understanding of that, hopefully that takes a little bit of the anxiety around the reintroduction process away. So the way that we would typically approach it in our clinic is that we would, it depends on the level of restriction, but if somebody's over restricting their diet, right from the beginning, we'd get them in with a dietitian to liberalize their diet, even to then follow a low FODMAP diet, because often we'll see patients that have gone well beyond a low FODMAP diet as an example. So if the particular patient has gone beyond that, then we'd get them back to that point where they're just restricting FODMAPs, or at least just restricting the foods that are the biggest triggers of symptoms in them, and it might not be that it's FODMAP related at all. And then I think after the hypnotherapy, we would then encourage them to go through the reintroduction process. And again, a good qualified GI specialist dietitian will go through that process. And you can kind of, approach that in 2 different ways. The way that it's typically done is that people reintroduce by category. So FODMAPs are essentially what we call short chain carbohydrates, which fall under different categories. And so, for example, we might get them to reintroduce lactose first, followed by fructose, or whatever it might be. And they do it in sort of a graded way so they can see if they are going to respond to something, that they can see a really clear response, if that makes sense. The other way is that instead of doing it by category, we do it by overall FODMAP load. So we get people to reintroduce things into their diet that contain FODMAPs, but not really large quantities of FODMAPs. And then sometimes in our patients who have a lot of issues around anxiety associated with food or disordered eating behaviours, we will usually go for that approach because there's less of a focus on specific quantities of food, if that makes sense.
Awesome. Someone was bringing up the, falling asleep during hypnosis. One, obviously, we've spoken about, if you're waking up at the end, it might not be sleep, you just might be deeply hypnotized. I guess, is there any tips you have to not fall asleep while during a session? Listen
to it earlier on in the day. It's probably, I know that sounds like a really silly response, but that's what I would generally tell people. Because often, and again, I don't know with this particular individual, but often people like to listen to it when they're sort of crawling into bed of an evening. It helps them relax and helps them fall asleep. Obviously, like we said, though, we don't want you falling asleep while you're doing it. So my suggestion would be to try and listen to it earlier on in the day. And, if that's not enough, then try listening to it while sitting up as opposed to lying down. And if that doesn't work, try and listen to it with your eyes open as opposed to your eyes closed. So you can, I suppose, just try and work with it as best as you can in public as opposed to in private. Go and sit on a park bench and listen to it, so you're not as likely to perhaps fall asleep as what you would if you're in the comfort of your own home.
Does gut-directed hypnotherapy help manage wind and stomach growling or rumbling?
Yeah, yep. So we don't look specifically at sort of noises associated with GI function as an outcome measure in clinical trials. But I can tell you anecdotally, my patients tell me that their tummies calm down, that they don't notice so many of those noises after hypnotherapy. And definitely changes in wind, yes. So that is something that we measure, and we've been able to show that we can reduce wind after a course of hypnotherapy. Again, keeping in mind that the gut is a muscle, and the way that it works is that it moves in and out on itself in order to propel the contents through. So you're meant to hear things in your tummy. In fact, we get worried if you don't hear anything. So I suppose the question, of course, is how much noise is there? And so, the first point of call, I think, would be to try and, reduce your focus on that and on that noise as much as possible. But hopefully over time, it will also subside after the hypnotherapy. And similarly, wind is normal. So you're meant to pass about 2 litres of gas per day. I have no idea how they measure that. I don't want to know. I have no idea how users are going to measure that. But I think the takeaway message is you're meant to be pretty windy, right? So if you are windy and it fits within that realm, again, I've got no idea how you're going to measure it, but if you think that it fits within that realm, it's probably nothing to worry about. If you think it goes beyond that, then hopefully the hypnotherapy will help. Or there's things that we can do from a dietary perspective as well to reduce wind. But I can tell you, if we have a patient that comes into clinic and says to me, hey, I've got really terrible wind, and I'll say, does it bother you? And they say no, I'll say, great, you don't need to come back. There's nothing wrong. We're not concerned about it. Unless it bothers the person, then obviously we can put some strategies in place to improve it. But that was a very long-winded way of saying, yes, hypnotherapy can reduce stomach noises and wind.
Long-winded, I like that. So someone's going through the Nerva program and they're curious to go into more detail around diffusion techniques that we discussed in the program, and provide suggestions where they can get more information about those specific diffusion techniques, and then maybe discuss what they are for people who haven't heard of them.
Yeah. So the idea, I guess, around diffusion strategies is getting people to focus less on their gastrointestinal complaints. So trying to create this void between overanalyzing and catastrophizing, and that having an impact on worsening symptoms, if that makes sense. So obviously we touch on this just very, we give some strategies in the app, which are really brilliant strategies, and we use these clinically as well. But I think if they're not enough, if you need more help from a cognitive perspective or more help from a behavioural perspective around that kind of thing, then it's probably time to link in with a GI-specific psychologist.
Awesome. I don't have any recommendations of where to find someone for that, but it obviously depends on your location and stuff, but I'm sure Google could help you with that.
Yeah, definitely Google can help. There's not a great directory that is set up in Australia. I know that in America, the Rome Foundation have a section on their website that is dedicated to, I think they call it Rome Psych or something like that, that has lists of psychologists that specialise in GI disorders around the US. So for any listeners in the US, you might find that a useful tool.
Can children use gut-directed hypnotherapy?
Yes, so most definitely. There's been some really nice work that's been done in paediatric populations, which has shown that hypnotherapy works with children. In fact, it probably works even better than in adults, because kids have really great imaginations. And so usually as we become older, we become more sort of refined in our thinking. Perhaps closed-minded isn't the nicest way to say it, but I think as adults we sort of become more sort of attention focused, perhaps a little closed-minded, but kids have great imagination. So typically they respond really quickly and really well to hypnotherapy. Yes.
Very cool. I'd imagine, their imagination during those guided imagery would be fantastic.
Absolutely.
I guess 18th century pharmacy what is 18th century depending on their age, but it would work.
We might have to tailor the language a little bit for a child. But no, they respond really well.
Awesome. Just aware of the time, we might there's one more question. So their question is I've started Nerva, but I'm also seeing a dietitian. Should I stop one of them? Will it muddy the waters?
No, Absolutely not. And I mean, look, to be fair, and again, I think I mentioned this earlier on, most people respond best to a multidisciplinary approach. Most of the patients that we see are doing a combination of different things at the same time. And that's fine. You can most definitely do both. That's not a problem at all. I suppose in research settings, of course, we like everything to be neat and tidy, and we like you to do one thing at a time so we can see, response. And if you do respond, is that because of A or B or C? But in the real world, most people will be doing a combination of things at the same time, and that's totally fine.
Awesome. And finally, I experienced bowel incontinence with IBS. So this is the person, and I'm using the diffusion techniques with hypervigilance, but I'm worried about that. The hypervigilance is what protected me from an accident. Like, how should I manage this?
Good question. So I guess the thing that's sticking out in my mind, if this was the patient who just asked me that question, we'd be doing a pretty thorough assessment about why the patient's getting the incontinence. So, for example, is it a mechanical issue? So we have sort of different internal and external sphincters that all need to work together and coordinate really well in order for people to have control over their bowels. And if there are issues there, then it might be that person needs help from a mechanical perspective, and it might be that person needs to see a pelvic floor physiotherapist as the first port of call, or it might be that person needs to see a surgeon if it goes beyond the realm of pelvic floor physiotherapy. We also see quite often in people who present with irritable bowel syndrome what we call overflow constipation. So the patient thinks that they have really terrible diarrhea, but it's actually possible that they're really constipated and they have what we call overflow diarrhea. And often this presents as incontinence in the context that patients aren't aware that they are experiencing the diarrhea until that they can feel that their underwear is wet, kind of thing. So it's about making sure you've got a really firm diagnosis in terms of what's going on there, and obviously the way that we would manage that would be different. If that patient had gone through all of those, every single option in terms of what was happening medically, and they were still experiencing the ongoing incontinence, we would have a conversation around how frequent that was, whether we needed medication to help that person to manage their bowel symptoms. And they're right, there needs to be an element of awareness around what's going on in order to avoid the incontinence. In saying that, it's probably more unlikely that people have bowel incontinence that relates to them being in a heightened sympathetic state, if that makes sense. They might have terrible diarrhea with urgency, but by the time they're experiencing frequent incontinence, there's possibly something else that's going on.
Yeah, that makes a lot of sense. Last question. Do you have any advice around, building habits around listening to Nerva if they're struggling to be consistent?
I think I usually just suggest to people that they find a particular time of day that works for them. So whether that's first thing in the morning, last thing of an evening, shutting the door at work while you're having, your lunch break, and listening to it then, driving home, sitting in the car before you enter into the house and listening to it then, just find something that you do every day. You go to bed every day, or you come home from work most days, or whatever it happens to be, and you associate that activity, listening to the hypnotherapy rather, with that activity. I think that's probably the easiest thing to do. Setting an alarm on your phone, I don't know, so that it goes off at the same time every day and you listen to the recording. But I think it just needs to be a priority. You just need to work as best as you can to find a time that's going to fit in with you. And if you miss a day here or there, don't freak out about it. It's not the end of the world. Just pick it up again the next day.
Thank you. I know I said final question, but this question comes up a lot, and it's already come up multiple times in the chat. Can hypnotherapy help with SIBO?
So SIBO stands for small intestinal bacterial overgrowth. And the jury's out in terms of, how to diagnose SIBO and how to manage SIBO. We often see that a lot of people who have irritable bowel syndrome have what they believe to be small intestinal bacterial overgrowth. And yes, hypnotherapy can help. I suppose the thing is that, I guess typically if we're treating small intestinal bacterial overgrowth, we do that with a particular type of antibiotic therapy, which is very safe for people to take. And then once that bacteria has been removed from the small intestine, we then continue on with something like hypnotherapy. The issue with this particular antibiotic is that people tend to respond really beautifully to begin with, but they don't always maintain that response. And so then it becomes a question as to whether we, continue to treat that patient or not. So that, again, a very long-winded way of saying, yes, it does help with symptoms that present of SIBO, and have a bit of a chat with your GP or your gastroenterologist about ways of managing it.
Thanks, Simone. Thank you, Dr. Peters, for coming on and helping a lot of people, hopefully. We'll send out an email to everyone who jumped off, but it's been great to have you.
Thanks for having me.
All right. See you later. See you,
Take
everybody.
care. Bye.